Good evening once again, everyone. I'm really happy to do this and to be doing this. Um, this is more like our first official antenatal class for the year, at least via Google Meet. And the class is expected to last for 45 to 60 minutes. After which, I'm sure we will have a lot of questions to ask, either here or in the group. So, if you are still with me, let me just have an emoji. Could you just give me a thumbs up? Let me know that we are together here. Okay. Thank you very much. So, we are discussing understanding body changes in pregnancy. And of course, this is reproductive antenatal class. At the end of the class, we will make the recording available probably from tomorrow after editing it. And it will be available on YouTube. And also, a link will be shared to you personally or in the group. So here is this is the table of contents. All right. So basically, we are starting with the introduction, the first trimester changes, the second trimester changes, third trimester changes, and postpartum changes. So by way of introduction, before we get down to business properly, we, as discussed the other day, pregnancy is divided into subsections. We have the first trimester, the second trimester, and the third trimester. And we were told, or we discussed, that first trimester is between conception to the first 13 weeks. So at 13 weeks, that brings an end to the first trimester. Now, from 13 weeks and above to 27 weeks, that's second trimester. And beyond that, from 27 weeks to 40 weeks is third trimester. And there are peculiar changes that a woman experiences in each of those sections. All right, so those are what we are basically going to discuss today. We want to look at the changes that take place in the body the moment a woman conceives. All right, if you are still with me up to this point, let me have a little emoji. Just give me a thumbs up. Let me know that we are still here together. Okay, thank you very much. So, the first changes that occurs when a woman conceives is hormonal changes. Now, we know that following conception, the moment the sperm fertilizes an egg and fertilization occurs, the body starts undergoing changes. At first, at the onset, we have what we call chemical pregnancy, being that the pregnancy is not visible yet via ultrasound scan. So the only way that a woman can know that she is pregnant is by testing for the pregnancy hormone, which is the HCG, that is the human chorionic gonadotropin. And from the day 10 of fertilization, that's between the 10 to 14 days, a woman can actually test and know that she is pregnant, either via the urine or blood test. Right? Then beyond that, maybe from 5 to 6 weeks, ultrasound scan can be done that will actually show that this woman is pregnant. Now, in Nollywood, I don't know, whenever I discuss antenatal, I like making references to Nollywood because a lot of people got their information from Nollywood, In Nollywood, if they want to portray whether a woman is pregnant or not, they will start by showing when the woman is vomiting. So you see a woman who is sweeping, singing, and all of a sudden she starts vomiting. And all of us, we just automatically know that this woman is pregnant. All right. So we have the nausea and vomiting of pregnancy, which we call morning sickness. All right. And this nausea and vomiting is caused by several factors. The first is the increase of the pregnancy hormone. So you now see that a woman who is pregnant within the first trimester, as the hormones build up, she experiences nausea. She feels like vomiting. and for some people, they actually do vomit. And this morning sickness can have several level of severity. We have the mild, we have the moderate, we have the severe form of it. We have those that the woman just feel nauseous. She doesn't actually vomit. Why? For some, when they are brushing in the morning, they throw up. For some others, they might vomit many times in a day. They can have countless vomiting and all that. Now, in cases where a woman vomits for a prolonged period of time, such that it requires hospital admission, we call that one hyperemesis gravidarum. Maybe one of these days we can just take time to discuss that, probably in the class, maybe when we talk about morning sickness as a topic. All right. So the first sign a woman has is following pregnancy is nausea and vomiting, which is referred to as morning sickness, and it is triggered by hormonal changes, increase in the human chorionic gonadotropin and some other hormones, as we see going forward. And also, this nausea and vomiting can equally be triggered by the increasing size of the uterus. All right. When the womb, which is the uterus, starts increasing, it can actually irritate or stimulate the intestine. Then such woman will now feel like vomiting. So as the uterus gets bigger, especially within the first trimester, most people tend to vomit. And it should also be known that it's not everyone that vomits in pregnancy. We have cases where people don't actually vomit in pregnancy. All right. And the factors that can influence vomiting or morning sickness in pregnancy might actually include genetic predisposition. We have people that maybe their mother, all right, vomited during pregnancy, so it kind of affects them as well, they vomit. And we have also people that maybe in the first pregnancy they vomited, so in subsequent pregnancy, the chances of them having morning sickness also increases. I'm already going far into morning sickness. Please, let's leave it at that. The second sign, all right, that follows hormonal changes is fatigue and constipation. I'm sure that, in your early pregnancies, you experienced fatigue, like you just wake up in the morning and you can't just move. It's as though you are so tired, fatigue, all right, and constipation. And this is largely due to progesterone. Now, progesterone is a pregnancy hormone. Please, are you still with me? Hello, if you're still with me, let me have a thumbs up. All right, thank you very much. Now, progesterone is a pregnancy hormone for women that experiences miscarriages, maybe recurrent miscarriage. All right, such women, most times we even give them progesterone supplements. All right, we can give them progesterone injection weekly in order to sustain the pregnancy. Without progesterone, pregnancy cannot stay. Without progesterone, pregnancy cannot stay. So progesterone is the hormone that largely sustains pregnancy. Now, because of the increasing nature of progesterone, one of the effects is it can cause fatigue. So a pregnant woman just wake up in the morning or even during the day, she's just so tired. She just wants to lie on the bed, just want to stay on the bed. And most times feel constipated, even after eating, can't really, empty boil, as the case may be. All right. The other signs that we experience as part of hormonal changes. Now, this is a picture of a woman who is actually passing through what we're talking about now. A woman who is vomiting. All right. All right. Now we have breast changes. Breast changes in pregnancy. When a woman becomes pregnant and the hormones start spiking all over the place, part of the changes that takes place in the body is in the breast. More blood flows to the breast. This can lead to breast engorgement. The breast becomes swollen and tender, where we call it breast changes. So almost everyone, in fact, every pregnant woman experiences changes in the breast because it's just natural, it just happens. As the body modifies, same as the breast becomes engorged, becomes painful, becomes very tender. And some people can actually come to the hospital to inquire why their breast is tender in the way it is. But that's just one of the, things that happens in pregnancy, breast changes. Now, breast changes occurs not just in the first trimester, because down the line, we are still going to see some of these changes again. There is increasing change both in first trimester, second trimester, and third trimester. So when we get to third trimester changes, we are still going to encounter breast changes in pregnancy. The fourth changes is mood. Pregnancy comes with so much mood swing. I know many of you have experienced this also. Pregnancy comes with mood swing. You know, a pregnant woman can be happy at this moment. In the next 30 minutes, she is sad. She just want to be left alone. You know, another time comes, she just want to be with the husband. She just wants to stay with people. You know, comes with a variety of mood, which we call mood changes. And you know, this mood swing also results from hormonal changes. So at least if you just bear in mind that these changes largely is due to changes in the hormone, all right, that accompanies pregnancy. Okay, let's go down to the next. Now, how many of you have experienced urinary frequency that increased in the number of times that you urinate in a day? Can I have your thumbs, please? How many of you? Hello? All right. Now for urinary frequency in pregnancy, all right, this is as a result of changes in the womb. You know, the first thing we talked about was hormonal changes. Then here, the second thing we're going to talk about in the first trimester is uterine changes. When a baby starts growing, the womb, the uterus, equally starts growing with the baby. Now, the uterus sits on the bladder. The uterus directly rests on the bladder and exerts pressure or force on the bladder. Now, the bladder holds urine like we all know. So imagine if you drop a load on a sachet water. Maybe you have opened a sachet water, so probably you just break it with a pin, then you now drop a load on it. What happens? Because of the pressure on it, more water will be coming out. So in pregnancy, the weight of the uterus on the bladder compresses the bladder and reduces the size of the bladder. So if maybe before you became pregnant, the bladder used to hold, let's say, 500 mils of urine before you want to pee. In as much as for some people, they can't even hold up to that. So let's assume that your bladder normally holds up to 300 mils of urine before you have the urge to urinate. When the uterus compresses on the bladder capacity will reduce to maybe about 200 or 150 mils in volume. That means once urine enters and gets up to 150, you feel like urinating. Unlike before that, the bladder will have to get up to 300 to 400 before you actually pee. But in pregnancy, especially as your uterus grows alongside the baby, most pregnant women will experience frequent urination. And here I said we are going to differentiate the frequent urination of pregnancy from urinary tract infection and diabetes. Okay, in urinary tract infection, people also experience this frequent urination, but it comes with pain. That's the major difference. It comes with pain. UTI, that's infection, UTI, comes with pain. Meanwhile, the not come with pain. The urinary frequency of infection as well, the volume of urine is small, much smaller than the volume of urine in pregnancy. This is also different from the frequency of urination in diabetes. In diabetes, the volume of urine is actually more, and the woman or whoever, whether man or woman, have the urge to drink a lot of water. So as they urinate, they drink more water. But in pregnancy, you don't have that much urge to drink water. As a matter of fact, because of nausea, because you feel nauseated, most people don't even like taking a lot of water. I hope you are with me. So because the woman feels nauseated in pregnancy, they don't even like taking a lot of water. But in diabetes, they take a lot of water and they urinate more. So those are like the differences between the urinary frequency of pregnancy and that of urinary tract infection. And it's also good to know that a woman can actually have both UTI in pregnancy, which we may discuss down the line. So let's not go ahead of ourselves. All right. The next is cervical mucus plug. Cervical mucus plug. I hope we are still together. Cervical mucus plug. In the first trimester, mucus blocks the cervix. I don't know, for those of you that were in class when we had our January free webinar on labor and delivery, we discussed something about that at the onset of labor, the cervix opens up and the mucus plug blocking the cervix falls off. Now, that mucus plug that falls off, which we call show when labor starts, is formed in the first trimester. So the moment a pregnancy is established, the cervix closes up completely. The reason for the closure of the cervix is so that infection will not drag from the vagina to the uterus, affecting the baby. All right, so that's actually how it has been designed, that the moment there is a child growing in the womb, the cervix closes up completely. So even for women who have threatened miscarriage, the cervix is still closed, but the moment the cervix starts opening up, before term, it's a sign of miscarriage. But let's not get ahead of ourselves. But just know that cervical mucus plug forms in first trimester, and it is part of uterine changes in pregnancy. Okay, let's go ahead, please. The third changes that women experience in pregnancy, is cardiovascular changes. Cardiovascular changes simply means changes in the heart and blood vessels. The first is increase in blood volume. Please, I hope we are all paying attention here. This is increase in the blood volume. Pregnancy causes the blood volume to increase. I think we also discussed this in one of our previous classes, that there is increase in the serum. And I think I gave an example using salt solution. All right. If let's assume that blood is made up of the red blood cell, white blood cell, and the platelet. And these cell components, like salts, are dissolved in a fluid called the serum. These make up the blood. So when you bring out the blood and allow it to settle, the blood will separate the cell and the liquid parts. So in pregnancy, the liquid part of the blood increases. And when this happens, a lot of things will start happening in the woman's body. All right. When this happens, the blood vessel will open up. As the blood vessel opens up, a woman's blood pressure will start decreasing. So you will notice that before you became pregnant, probably your blood pressure was around 120/80. But in pregnancy, you are now recording blood pressure of 100/60. Some pregnant women even experience blood pressure drop of maybe 90/50, as the case may be. And this can result to hypotension, that is reduction of blood pressure or low blood pressure, which causes dizziness and lightheadedness. So you now see that a pregnant woman will just have this off and on dizziness, off and on lightheadedness. This is likely due to reduction to hypotension. All right. Now, another consequence of increase in the blood volume is that when the blood volume increases, the blood level decreases. The blood level drops, and it's because of this that pregnant women are actually encouraged, to take those hematinics, all those your folic acid, fesolate, B complex, as the case may be, that may come in different forms. Pregnant care, natal care, name them. All right. Now, because when the blood volume is just like we have our salt solution, then you now increase the water in the salt solution. What happens? The concentration of the salt will reduce. So in the same way, when the volume of the blood, the liquid part of the blood increases, the cellular part, especially the red blood cell, will drop. So an expectant mother is expected to take all those hematinics to assist the body in making more blood cells. All right, it is very important. Now, this is as a result of the cardiovascular changes in pregnancy. All right. So let's go on to the next. Second trimester. If you are with me up to this point, let me have a thumbs up, please. If you are with me up to this point, let me have a thumbs up.
Yeah.
All right. So I think we should go ahead, right? We are still together, right? Okay. Okay, thank you very much. So we have discussed the first trimester changes, and we'll go over it at the end of the class. Let's look at second trimester changes. Second trimester changes. All right. The first thing that we're going to discuss under second trimester changes is stretch marks. Stretch marks. All right. Now, in the second trimester, we start from 13 to 27 weeks. All right. At this point, a woman's uterus is getting bigger and bigger. All right. The baby bump is beginning to appear and even get bigger. This causes a stretching of the skin. The skin of the abdomen will stretch. All right. And even at the same point, remember that in the first trimester, there is already breast changes. The breast is getting bigger, is becoming engorged. All right. Now, this causes the skin over the breast as well to be stretched thin. So you now see stretch mark appearing on the abdomen of a woman who is pregnant, even on the breast as well as the thigh. So stretch mark is very common in pregnancy. All right. And this is just due to skin changes that accompany pregnancy. The next is darkening of the skin. Basically, the skin of a pregnant woman, all right, a lot of people, it will get dark. This is largely due to increase in blood flow to the skin. So the skin in pregnancy experiences more blood flow, all right, which causes this darkening. Now, this darkening is more profound, much more profound around the nipple, that's the areola. So you will experience that your breast, your areola even increases. The diameter of the areola increases. Of course, we all know what the areola is. That's that dark area that circles the nipple is the areola. So you experience that in pregnancy, that dark region enlarges and even becomes darker. All right. Also, the skin generally becomes darker. The face becomes darker. Whether you are fair or dark, you notice that there is darkening of your face as well as your thigh. And all this, as we have discussed, is as a result of increased blood flow to the skin and as well as the effect of hormones on the body. All right. Can we all see this picture? Can we all see this picture? Okay, so this is the picture that illustrates what we've been talking about. As we can all see, this is a pregnant abdomen, and we can all see the stretch mark all over the abdomen. Now, when this woman delivers, the abdomen will shrink, but you will still see the stretch mark. Anyway, we'll talk about that in another class and talk about what to do in this kind of circumstances. Number 5, uterine expansion and growth. Uterine expansion and growth. In second trimester, now let me just go back a little. In the first trimester, most people, you can, if you want to hide the first trimester pregnancy, it's very possible. Why? Because the size of your womb is still very small, so you can easily cover it with clothes. All right. But in second trimester, there is rapid increase in the uterus as well as the size of the baby. Now, this causes number 1, weight gain. Right? Weight gain, that increase in size of the uterus and the growth of the developing fetus causes a significant weight gain. That's one of the changes. Then secondly, we have back pain. Back pain. Remember that this expectant mother, her abdomen is getting bigger. It's getting bigger and bigger and bigger. And as it gets bigger, there is a lot of pressure which is being exerted at the back. So you now see that as the abdomen protrudes forward, the back comes with it, and then it comes with back ache. This happens in second trimester. First trimester, you are pretty much still very straight. All right, there is no curvature whatsoever of your back in first trimester. But from second trimester upward, because of increase of the uterus, there is backache, all right, due to increased pressure on the back. Also, at this very stage, because of the expansion and growth of the uterus as well as the baby, most pregnant women experience heartburn. Now, this heartburn comes because of compression of the stomach. The stomach is compressed, and when the stomach is compressed, what the thing that happens is that the stomach will not empty quickly. So after eating, the food may remain in the stomach for a long time. And also remember that the stomach has acid, all right? Acid that helps in digesting food. So when the food stays so long in the stomach, the consequence is that more acid will accumulate, which will cause or result to heartburn. So experiencing heartburn is very common in pregnancy. We should know that. Of course, what we can do to help at this stage is to give antacid. So we can just give you Gascol, Gestid, which will help at least in the second trimester. Although as the pregnancy advances from the third trimester, just before labor starts setting in, there will be a reduction, all right? The uterus will move further down. So most women don't experience heartburn from third trimester, but in second trimester, heartburn is very common. Are we still together? Please, let's go on. Are we still together? All right. Thank you. Now, some other changes that also happens from uterine expansion and growth. Some other changes that also occur is Braxton Hicks contraction. Let me also make a reference to the class we had on labor and delivery. In that class, we talked about false labor and true labor, and we said that Braxton Hicks contraction is a false labor. All right. So most people start experiencing Braxton Hicks contraction from second trimester. All right. And this is as a result of the expansion of the uterus. Also, in second trimester, there is what we call quickening. Most pregnant women, in fact, not most, every pregnant woman starts experiencing the movement of the baby in second trimester. If through a second trimester you don't experience your baby movement, there is problem. All right. So we should understand that if you don't experience baby's movement in pregnancy in second trimester, there is problem. For women that have had babies before, all right, they may experience this quickening earlier on, probably from 16 to 18 weeks and above. But for first-time mothers, the quickening starts maybe beyond 18 weeks. I've even seen some people that experience their baby's movement from 22 to 24 weeks. All right, so we call it quickening. Now, this is because one, there is increased size of the uterus. Two, the baby is also growing to such an extent that they can move their limbs, they can move their body and kick around. All right, so we call that quickening. Also, in the second trimester, women are encouraged not to lie on their back. So you don't sleep facing up. I hope we are still together. You don't sleep facing up. And the reason why you don't sleep facing up is because if you sleep facing up, remember that your uterus is actually large right now. It's really large. If you sleep facing up, the weight of the uterus will rest on your large blood vessel, which we call the aorta. It will rest on it, and when it compresses it, you will start feeling lightheaded. Also, compressing it will equally reduce the blood that goes to the baby through the placenta. All right, so it's actually not good that a woman should lie on her back face up in from second trimester till delivery. All right, I hope we are still together. Please let me have a thumbs up. I hope we are still together, please. Okay, thank you very much. Let's go on. Third trimester. So we have discussed changes that occur in the first trimester. We've discussed changes that occur in the second trimester. Let us now look at the changes that occurs in the third trimester. The first change that a woman experiences in the third trimester is pelvic pain. Pelvic pain. Pelvic pain arises because of the uterus and the baby. In fact, most of the symptoms you experience from second to third trimester is because of the uterus and the baby. Most of those things that experience, that's just it. So the first is pelvic pain. This pelvic pain simply occurs, okay, due to the weight of your womb resting on the pelvic organs. That's the first. The weight of the womb resting on the pelvic organs, not just the weight of the womb. When I say the weight of the womb, I mean both the weight of the womb and the increasing size of the baby. Because from third trimester now, your baby is actually adding weight rapidly. So we have a baby who is weighing, 2 kg and above and all that, exerting pressure on the pelvis, as well as the uterus, which has actually really increased in size. So most pregnant women experience pelvic pain from third trimester. Again, another cause of pelvic pain is the stretching of the pelvic ligaments. Okay, all those ligaments holding the joints, the pelvic bones together. The body starts stretching it out so that there will be more space for the baby to grow, as well as more space for the baby to pass through during labor. So all those stretching and the pressure of the baby and the womb causes pain. That's pelvic pain. That's third trimester now. Also in third trimester, so many women will experience leg swelling. So you now see that the leg will start getting bigger and bigger. Now, I want to also explain here that leg swelling can be both normal and abnormal in pregnancy. Leg swelling can be normal and abnormal in pregnancy. The normal leg swelling in pregnancy is largely caused by, the pressure of the uterus on the blood vessels, which now make blood fluid to settle in the lower part of the body. Okay, but in conditions such as pregnancy-induced hypertension, which is a situation whereby a woman who was not previously pregnant hypertensive becomes hypertensive in pregnancy, especially in the severe form of it, such people can experience leg swelling. So what do we do? Wherever you are having your antenatal, when you experience leg swelling, one of the things that can be done to differentiate between the normal leg swelling and the abnormal leg swelling is to do a urinalysis. So you must do urine test to differentiate or to know if this leg swelling is due to the normal pregnancy changes or not. Also, your blood pressure must be checked. So if you have a normal blood pressure and your urine is also fine, then the leg swelling that you are experiencing is actually part of the normal physiological changes in pregnancy. It's very, very important to know that. Now, this leg swelling in pregnancy can also be painful. You start having heaviness in your leg, you can't really walk properly, you can't really move, you want to put on your footwear and your leg cannot enter. Your leg is becoming more painful and painful as the case may be. All right, that's leg swelling in pregnancy. Okay, let's go on to the next, please. We are almost about rounding up. All right. Can we all see this picture? Okay, so this illustration here, the second picture that we can see here. All right, so the second picture that we can see here just illustrates, the baby kicking the mother, just kicking from inside, and this one experiencing a lot of pain and what have you. This is the picture of varicose vein, which we are going to discuss along the line. Now, in third trimester as well, some women will experience, what we call varicose vein. The vein becomes enlarged and tortuous, like you can see in this picture. You can see the back of the knee. You can see that there are very visible veins on the skin. These are called varicose vein. It's also very common in the third trimester. All right. Other changes that expectant mothers experience in the third trimester is still heartburn and constipation. Now, for some people, the heartburn they experience in the first trimester might actually get worse in the second trimester. So you can see an expectant mother having more heartburn, but just before labor starts, when the baby starts moving down into the pelvis, all right, this heartburn will decrease because there is less weight on the uterus. Okay. Again, frequent urination. Remember that right from first trimester, an expectant mother or a pregnant woman has been experiencing frequent urination. this can get worse in the third trimester because of the rapid growth or because of the large size of the womb resting on the bladder. So when that happens, you now have a lot of pregnant women maybe cannot even hold urine like anymore. So once a little urine enters, they feel like urinating. And for some people, they can experience urinary incontinence. Okay, urinary incontinence is simply a situation where someone is pressed or you feel pressed, but you cannot hold urine. So that means if you delay before getting to where you want to, void, the urine can actually start trickling out. So these are some of the things that accompany pregnancy. But, well, incontinence doesn't happen to everybody, but everyone experiences increase in urine and in urination. The next is breast discharge or lactation. In the first trimester, like we discussed already, there is increased blood flow to the breast. In the first trimester, there is increased blood flow to the breast. So this causes the breast to enlarge, to become engorged and even tender and all that. And more breast tissue is being formed. In the third trimester, part of the sign that some people experience is that the breast will start discharging or they will start lactating even before the baby comes. All right. So we have a lot of pregnant women who, as they are getting to 36, 37 weeks, before before labor set in, their breast will start discharging. They will start lactating. All right. So those are like some of the things that equally accompany pregnancy. All right. And the first part of the breast that comes out is what we call colostrum. Colostrum. We will discuss this more when we talk about breastfeeding. But for now, it's worthy to mention that in the third trimester, some pregnant women will start lactating even before the onset of labor. So let's look at postpartum changes. Please, if you are still with me, let me have a thumbs up. If you are still with me, let me have a thumbs up, please. Okay. All right. Thank you very much. Postpartum changes. Postpartum simply means the changes that occur after delivery. From what we have seen so far, coming from first trimester to second trimester to third trimester, there are several changes. The uterus is getting bigger, the abdomen is stretching, the woman is having stretch marks, and all those things. Following delivery, there is a reversal of those changes that have taken place, and we call them postpartum changes. Okay, so let's quickly look at the changes that occurs after delivery. The first change that occurs after delivery is lochia. Lochia is the first change that occurs after delivery. This is simply vaginal discharge, or vaginal bleeding that starts as soon as that starts after delivery. Remember that when we talk about labor, when we discuss labor in the January webinar, we say that the third stage of labor involves from the delivery of the baby to the delivery of the placenta. When the placenta come out and the delivery process is completed, a woman will still be experiencing spotting or vaginal bleeding, but it's not going to be a very heavy bleeding. It's just light bleeding that we call lochia. All right, light bleeding, which we call lochia. That's what a woman will be experiencing. Okay, so this lochia can actually persist for a couple of weeks. For some people, they might have it up to a month. They just keep on spotting. But in this case, it is different from actual bleeding because the blood or the fluid that comes out is discolored. Okay, it has different colors. Some can be very, maybe at first it may be red, then become darker, then becomes brownish, then become lighter and lighter as the case goes. Anyway, it's part of what we'll be discussing in the class subsequently. So that's the first change that occurs following delivery or in the postpartum stage. The next is reduction in the size of the uterus. You may be asking, what happens to my womb now? Is it going to be like this? Is my stomach going to be as big as it is? Of course, not stomach, the abdomen. Is my abdomen going to be as big as this? No. From delivery to the first 6 weeks, there is a reversal of most of the changes that have taken place in the course of the pregnancy. Let me say it again. From delivery to the first 6 weeks, we refer to that period as the puerperium. All right. Now, this period is characterized by reversal of all the pregnancy changes. So that also includes reduction in the size of the uterus. So the uterus becomes smaller and smaller and smaller. All right. And that's why we encourage mothers, please, following delivery, it's not necessary that you tie your abdomen, at least in the first 6 weeks, because the body is still experiencing gradual changes. Unfortunately, many women will not want to wait for that 6 months. I mean, for 6 weeks for their belly to get back to normal. So some will start tying, and when you tie immediately after delivery, you can trigger bleeding. So please, your uterus will go back to normal side. All right, after some weeks, there is no need to tie. Even if you tie your belly, it will not reduce the size of your uterus. All right, rather it can even be complicated by uterine bleeding, which may put you in trouble. All right, we are almost done. The next is emotional changes. Emotional changes. Remember that we discussed about mood changes from the first trimester of pregnancy. Following delivery, a lot of women will experience changes in their emotions, changes in their mood. So you can see a nursing mother or a woman who has passed through the throes of childbirth. Instead of her to be happy afterwards, she will just become depressed. She will become anxious. And some of these things, the anxiety, the depression, the PTSD, all right, those all these things is just from both her experience in the pregnancy as well as the withdrawal of hormones. Remember that during the pregnancy, this woman experienced hormonal surge, so much hormonal surge. All right. Following delivery, the body has to go back to the state it was ab initio. So when this happens, she's also going to experience mood changes the same way that she was experiencing mood changes in the first trimester. But for some others now, there might even be some other issues, such as loss of libido following delivery. So you can see so many women, at least I've seen them in clinic, all right, they will come and they will complain that they don't have the desire for sex anymore. They don't have the desire for sex. Or even their husband can even come and complain and say, "Doctor, when can I start meeting my wife? Because she doesn't allow me to touch her." And some of the reasons for this is because such women remember probably the trauma they passed. Maybe if they had during delivery, the thought of probably being pregnant again and also passing through what they passed through, especially for those that had traumatic pregnancy. Okay, so this can give rise to this. Postpartum depression, post-traumatic stress disorder can actually occur, and it is a very serious thing. So if after delivery you start experiencing some of these things that I've mentioned here, it will be very important that you talk to a physician, talk to your doctor. For some people, you might even need specialist counseling in order to come out or to heal from those emotional problems. Okay, so this brings us to the end of the class. Let's conclude. In conclusion, please, if you are still with me up to this point, can I have a thumbs up? If you are still with me up to this point, let me just have a thumbs up. Thank you. All right. In conclusion, pregnancy is a physiological condition that impacts heavily on a woman's body. Please know this. Pregnancy is not a sickness. Pregnancy is not a disease. It's a physiological state. But in as much as it's a physiological state, it impacts heavily on a woman's body. Also, the changes one experiences in pregnancy can be draining. Yes, pregnancy can be draining because of those changes. It can be physically draining, emotionally draining, psychologically draining. All right. Just imagine from conception, you are having nausea, you are vomiting, For some people that have very severe form of nausea and vomiting, that's hyperemesis gravidarum, they are going in and out of the hospital. Some are becoming sick because of reduced immunity. So many things going on. Your body has changed. For women that used to slay, like all these our baby girls, right now their faces have changed. Like, of course, you guys know that in pregnancy, I didn't even mention, there is also changes in the nose. All right. Their nose is becoming bigger. They're no longer as beautiful as they used to be and everything because of all these changes. So it can actually be draining, both physically, emotionally, and psychologically. However, these changes are necessary for the sustenance of the pregnancy and eventual delivery of a baby. Hence, the sacrifices a woman makes during pregnancy is very much justified. Because some people will asking, hey, why should I go through all this stress? Yes, my dear, you are going through all this stress to have a baby. If your body does not adjust in that way, the pregnancy will not stay. If these changes are not in place, pregnancy can never stay. The pregnancy will not be sustained. So the changes you experience during pregnancy is actually justified. All right. So that brings us to the end of the class. Thank you very much. Thank you, guys.